Hey everyone, Shanta Jackson here, your favorite thought leader and YouTube host and Facebook Live host and all of that, right? Welcome to today's show. Happy Saturday. We are streaming live on Facebook and YouTube. And today's topic is the COVID-19 vaccines, or are the COVID-19 vaccines, should I say. And we have with us Dr. Cassandra Esperanz. She is by training an HIV, or by practice, an HIV pharmacist. And she was a previous guest, and she talked to us a little bit about HIV/AIDS care, and then also the medications that for individuals who are not, or who have not been diagnosed with HIV, can take to prevent from getting infection. And so maybe if we have a little time, she can answer questions about HIV PrEP and HIV care. But today, again, our topic are the COVID-19 vaccines. Currently in the United States, there are 2 authorized vaccines. And as of December 28, 2020, according to the Centers for Disease Control and Prevention, also known as CDC, as of December 28th, there were 3 vaccines in the final, or phase 3 clinical trial. So there are more vaccines to come. And then also Johnson & Johnson, they are in the early stages of their trials for their vaccine, which will, they're planning for it to be a 1-shot vaccine, not 2 doses. So again, Dr. Cassandra, she's going to talk to us a little bit about that. In the United States, we've had over 23 million deaths. And I'm sorry, we've had over 23 million cases, and and we're almost at 400,000 deaths in the United States from COVID-19. Please do chime in, ask any questions. There's no right or wrong question. There's no dumb question or anything like that. I do encourage you to ask your questions. And without further ado, I'd like to bring on Dr. Cassandra Esperant. Hey, Dr. Cassandra, how are you?
Hey, Shanta, how are you? I'm so excited to be back on this platform. I feel at home.
Yeah, I'm excited too. Our show was very, very well received when we talked about HIV/AIDS. And some people that are watching right now, they are not familiar with you. So tell us a little bit about your training and your practice. And actually, you are a pharmacist. And when you tell us about yourself, let the people know about your training and the role of a pharmacist.
Sure. So again, my name is Cassandra Esperant, and I'm a clinical pharmacist with specifically trained in HIV prevention, which means treatment, meaning when someone is undetectable, they cannot spread HIV if they are HIV positive. And if someone is in a high risk group who has a high risk of getting HIV, they can take a medication either called Truvada or Descovy to prevent them from getting HIV. So that's pretty much what I do. HIV is a public health issue. And as an HIV pharmacist, I am trying to do my part in battling that disease state.
Okay, and so so you mentioned clinical pharmacist. COVID-19 is new. We're not even a full year, or we're on the anniversary, on the verge of a year at least of knowing about the virus, right?
Correct.
And so, like you, other professionals in health and human services have had to kind of switch gears a little bit and learn about COVID-19, and now about the COVID-19 vaccines. So tell me a little bit about your professional training and development with COVID-19 and the COVID-19 vaccines.
Great question. So HIV is also an infectious disease similar to COVID. And I'm sure everybody's familiar with Dr. Fauci. And Dr. Fauci is actually one of the, top physicians when it comes to HIV. And from the beginning, he was there in the front line. So, COVID vaccine is right along those lines. That COVID infection is right along those lines because it is an infectious disease and it is a public health issue. And it has a lot of similarities in terms of stigma and disparities to HIV. So as a pharmacist, I'm actually also an immunizer. So in the phase 2, when the rollout begins, I will actually be vaccinating, people for the COVID-19 vaccine. So of course I have to keep up with the data and make sure I'm up to date with the information, not only because I'm a pharmacist, but also, for my personal views to decide whether or not I want to take the vaccine. So that's definitely been something that I have done and kept up with the data to make sure I'm up to par with all the knowledge as it develops.
Okay. And in general, how do vaccines work just in general, and how have they contributed to the health and wellness and welfare of our society?
That is a great question. Well, it's because of vaccinations, we're able to live as long as we live today. For example, like there's something called the Spanish flu of 1918. And the only reason that, people were able to survive that was because they were vaccinated, and it was actually mandatory. Then a few years later, they actually made it optional. And what ended up happening, more people started dying, because what a vaccine does is it introduces the body to either a piece of the virus or makes the body believe that it's a piece of the virus, so that the body can mount immunity, create antibodies, so that if the body ever gets exposed to the virus, it'll know how to fight it off. So that's a general, definition of what a vaccine does.
Okay, so with the 2 COVID vaccines that are available, how do they work?
Great question. So the mRNA vaccine is for the 2 vaccines that are available on the market. One is by Pfizer Biotech, called the Pfizer vaccine, and the other one is called Moderna. And the technology that's utilized for this vaccine is called mRNA technology. So what does that mean? mRNA technology is the messenger RNA, which is like a message, that is in a liposomal pocket, little liposomal pocket. What it does, it sends the message to the fighter cells to create that little spike thing on the coronavirus, so that the body can build immunity in the case of being exposed to COVID, right? So you would have less incidence of the virus, right? So the messenger RNA is kind of like a Snapchat message, right? It just comes in, it delivers the message to make the spike protein, then it actually degrades, right? So I know there's been a lot of concern of it integrating to the
What is degrade?
It means to break down and be eliminated. The body's enzymes would actually break it down and eliminate it. So it doesn't last around too long at all. So, because I know there's been some people who have the myth who believe in the myth that the actual vaccine integrates into your DNA, but because of the mechanism of action of the vaccine, that is definitely an impossibility to happen.
Okay, I'm glad that you mentioned that, because I asked a few people on Facebook, and I'm looking for the post now. I asked a few people what were their plans or their thoughts about the vaccine, and someone mentioned that. Someone was like, "Oh no, I'm not getting the vaccine because it alters my DNA." And then another person, she posted that she'll only get the vaccine if it's mandatory, and that it causes infertility. And so I responded back and I asked her, could you please cite the research? Can you share with me where you read that? And she says, oh no, a friend told me that somebody else told them, that was their doctor said, so my thing is for us to, it's not just about COVID-19 or the COVID-19 vaccine, just anything that we're researching, we have to learn. There's so many people with different motives that plan messages, that create websites, that spread and share propaganda for various reasons, because they're anti this, anti-government, anti-whatever, because of their personal motives, or sometimes even they really do believe it, but usually sometimes some things are myths and then some things are just straight up lies. But it's up to us to be able to educate ourselves enough to at least think critically and identify valid information and reliable resources. cdc.gov. If you're confused, if this journalist is confusing you, or this news outlet, or you went on Google and something.com popped up, but you're not really sure, I can create a .com today. Dr. Cassandra can create a .com today, and we can put whatever we want on that website and say Dr. whoever. But I would just encourage you all, if you're confused and if you don't know, if nothing else, just go to cdc.gov, and then at least you know that you're having the most up-to-date and factual information if you're confused, because we got to stop the hearsay. And this is just about politics. This is about diet, food, education for our kids, laws, whatever it is. We have to hold ourselves accountable and to a higher level to make sure that we are receiving the right information and that we're sharing the right information. And it's not intentional, but what we don't want to do, we don't want to be messengers of the wrong information, regardless of what it is.
Yeah, I completely agree with you, because again, we have to learn to control our thoughts, right? Because the first thing that usually comes to our mind is something negative, right? So I'll even be honest with you. I remember when this conversation first came up, I kind of had that same reaction, and I'm a pharmacist, right? Because they said that it was going to be rolled out, and I kind of had the feeling that it was a little bit politicized and science was being influenced. But at the end of the day, you have to look at the research. And when I looked at the research and gathered all the content, I realized that there was more pros than cons, because there's always risks versus benefits when it comes to medicine, always. So you definitely have to weigh the risks versus the pros versus the cons to make an informed decision. You cannot just say that I don't think I'm going to take this vaccine because it's too politically incentivized and they're just trying to give me the mark of the beast. I'm not going to lie and say these things did not run through my head. But when I did the research, I was able to dispel these negative thoughts that I had.
Thank you for that. And so just to recap, I'll check in everyone on the comments in a minute. Just to recap, you mentioned that there are 2 vaccines that are out right now. So there's Pfizer and Moderna. So Pfizer and Mrna, and those 2 vaccines that are currently on the market are COVID-19 mRNA vaccines.
Correct, and they're approved under an emergency use authorization.
Okay,
it's not yet FDA.
It's not yet FDA approved. It's emergency.
Exactly.
Okay. So listen to that, everyone. Again, this is just information for you to make your own informed decision for yourself, right? So if some people may not feel comfortable with taking it because, hey, it's not FDA approved yet. But what does that mean? What's the difference between emergency use and FDA approval? And is there any difference in the science? And then also, how did the vaccine come out so fast?
Okay, so that's a great question. So the minute that COVID was discovered in Wuhan, they started sequencing the genome, which means they're trying to figure out how it's structured so that they can start creating the vaccine. So this was started back in January, December. So the mRNA technology has actually been around for over 10 years. They've actually attempted to come up with vaccines to treat HIV with that technology. So what we need to know is that the technology has always been around for a long time. And with that being said, when the vaccine underwent the phases, which is phase 1, 2 through 3, they kind of were able to undergo all the phases kind of simultaneously and start the production. Why? Because everybody in the entire world was working on this. So academia, private business, and government came together to make this happen. And I'll be honest with you, usually it takes about 10 to 15 years for a vaccine to be developed. But we were able to come together, do the research. A lot of funding was poured into it, and they made sure they even stopped the trials when they found that, somebody would pass away. And it may not even be a correlated causation. It could be that they got into a car accident and they were just in the study. So they actually stopped the trial just to ensure that, everything was going well and that they were doing it based on all the clinical guidelines. So it's
Okay.
definitely important to understand
Okay.
that.
And so for those who are just, so just recap for those who heard it, and for those who are just joining in. So the mRNA vaccine, is it a live virus that they're putting into us, or is it a protein? Like, just reiterate that for me.
It is an inactivated vaccine. So it is not a live vaccine.
It's not a live, so it's not the live virus that they're putting inside of you.
Correct.
And your body builds up the antibodies, and your body comes familiar with the virus, and then eventually the vaccine is dissolved and it goes away in your body.
Right.
You have the remaining antibodies. Is that correct?
Right. So basically, the messenger RNA, it goes in an envelope, which is like the liposomal pocket. The messenger RNA is inside of it, right? So that messenger RNA sends a message to the cell to create that little spike protein. So that spike protein is what allows the body to create the antibody, so that if there's ever any exposure, that it can mount off the fighting effect, right? But that messenger just degrades, it disappears, it breaks down. The body breaks it down and it goes away.
Okay.
So if you think about it, it's even safer than a typical vaccine, right? Because usually in a typical vaccine, your body gets exposed to a killed version of the virus to create immunity. In this case, it's a message.
Okay. And we do have a question. We have, hey, Raquel. Raquel is checking in from Las Vegas. She says, happy Saturday. And hey, Jacqueline. And then my mother, Belinda Norwood, is checking in. And she says, it's a great topic. And what are the side effects of the vaccines, if any?
That's a great question. Injection site reaction, which means you could have pain at the site where you got the vaccine. Some people feel fatigue. Some people get headaches, and very, very less incidence of this, but some people do surmount and get a fever. And you know what? That's actually a positive thing, because your body is reacting well to the vaccine, and the more reaction you have, the greater the amount of immune response. So that's actually not a bad thing if you can get through it. And the reality is that the second dose, because remember, this is a 2-dose vaccine, right? So the Pfizer one is separated by about 21 days, and the Moderna one is separated by about 28 days. So based on everybody who's been getting vaccinated and based on the science, you usually experience more side effects during the second dose. So the amount of reactivity to the vaccine seems to increase during the second dose. And it is okay to take Tylenol or Motrin to help with that. But a lot of the times, it was recommended sometimes to take either the Tylenol or the ibuprofen prior to getting immunized. But in this case, there's studies that show that if you do that prior, your body may not respond as effectively to the vaccine. So it's best to, let it have its onset. And once you start feeling that pain, or once you start feeling that headache, you take either that Tylenol or the ibuprofen.
Okay, and so, but the so far, what you've just mentioned as far as the side effects, that's common with any vaccine, to my understanding.
Correct. They're all similar side effects.
Okay, now what about allergies? I believe it's the Pfizer vaccine. If someone has allergies, they should not take that one. I know and I just read an article, and I have to read into more, but there's a headline yesterday, 23 people died in Norway after taking a vaccine, one of the COVID vaccines, and 13 of those 23 individuals were in nursing homes. And in some states, the priority populations are elderly, but now the advice is, at least I believe and correct me if I'm wrong, at least for the Pfizer vaccine, There's question about elderly or questions about allergies. Could you please advise on that?
Right. So if someone has a history of severe allergic reaction, they do advise that you take, use caution and, you go under medical advice and maybe be observed. But most of these can be treated. So once you get the vaccine, it is required that if you have a history of severe allergic reaction, that before you leave the vaccine site, that they observe you for about 20 minutes. So most of these reactions can be treated by like an EpiPen, which is epinephrine, which is what you usually inject someone who's having severe allergic reactions. So it's definitely something that they can challenge taking the vaccine, but they should be closely monitored. And it is required that after getting the vaccine that you be observed for 15 minutes, even if you don't suffer from these severe allergic reactions. So, I mean, this is a new vaccine. Things are going to happen. We're always going to have to do the research to make sure that, when people do pass away, that it's a direct correlation to the vaccine, or it could be something or whether it's going to be something that would have happened regardless. And it just happened to be during the time that the individual got vaccinated. So there's a lot to, filter through and decipher.
Okay, and so for those of you who are watching, let us know, what are your plans for the COVID-19 vaccine or for the COVID vaccine? And so I say COVID-19, but then there's a new strand of COVID that originated out of the UK. And I read that it's a possibility, or I was listening to on C-SPAN. I forget the person that was speaking, but she said that it's a possibility that could be the dominant strand by the summer. Have you been hearing anything about that?
Yeah, I did hear about that. And I did hear also that it actually is easier, it's more infectious, so it's easier to get this version. But, again, we still have to do everything that we're doing now. The vaccine will work for it. We still have to social distance, wash our hands, and avoid large crowds, right? Because we need enough of the populations to get vaccinated so that herd immunity can be created so that we can get past this. And the vaccine just decreases the level of disease. It doesn't mean that the person won't be asymptomatic, but that's something to definitely be aware of.
Okay, so I need you to explain that phrase. So we have a lay audience. Okay. So when you said asymptomatic, and we actually have a few questions as well. We have Lorinda, she's in Chicago. She said she's still processing her thoughts around the vaccines for COVID-19. And Latoya, I see your questions and I'll get to those in a second. Someone and I'm looking down because I'm looking at my phone. When I posted the question on Facebook, someone mentioned that they are interested in getting the vaccine, but they're just waiting for COVID-20. So my question to you is, we just mentioned that there's this new strand that is more infectious. Will the current vaccines help against the new strand, or is that to be determined?
So far, yes, but there's another strand, I forgot the name of it, that's on the rise as well. And again, they have to do the research. But as of now, the thing is that you have to get both of the vaccines. If you don't get both the vaccines, the immunity will not, when you delay the amount of immunity, it can cause issues with the variants also. So it's all about trying to get vaccinated as quickly and create that herd immunity that will actually help with that situation as well. So yes, there's still studies that need to be done, but the UK variant, so far, based on the research, the same vaccine, which is the Pfizer or the Mrna, will be beneficial.
Okay, and then also, oh wow, I just lost my train of thought. Give me un momento. Oh, it was a question. It'll come back to me. Oh, I can't believe I just did that. All right, so she says that she doesn't plan to get the vaccine, but she appreciates all who are making the sacrifice to help save lives, including possibly their own. And she has a question for you. She says, what about the lady on social media rocking nonstop, saying it was a reaction from the vaccine? Have you seen that video?
No, I haven't. What video is this?
Yeah, I haven't seen that. And do you think she's faking it? So, Latoya, I'm not familiar with that. Again, yeah,
She
I
was
can't.
rocking. Okay, I see.
Yeah,
She was rocking.
Yeah, so I haven't seen the video, so I can't respond to that. I don't know. Sometimes our reactions are psychological. Sometimes they're physical. Sometimes we could have again, people have allergic reactions. And so for me, I think as a health educator, I can't give medical advice, but as a health educator, I can educate and encourage people to make the best decisions for themselves. And I think one of the things that if you do have allergies or if you have a medical health history, maybe getting the vaccine at a public distribution site or at the public health department is not the best idea for you. Maybe it's go to your doctor, someone who knows your medical history and who has access to your medical records and that knows you, and they can advise you on which vaccine, because there's 2 on the market. As I mentioned earlier in the show, there are 3 more vaccines that are in their phase 3. I think it's phase 3 trials.
Phase 3, correct.
Yeah, we have more vaccines to come. And so again, if you're concerned, actually talk to your primary physician. That's what I would suggest.
Well, that's a great question that she posed, but also I don't know about the rocking, but I do know that there's been incidents of Bell's palsy, which is like a facial paralysis that in most of the cases that it was found did go away. And again, there's always risk versus benefits with vaccinations. This is not the first vaccine. The only difference is that this vaccine, the whole world is watching it. That's the only difference. But, every vaccine has their side effects, and there's always going to be risk versus benefits.
Okay. And so I'm looking at my comments. There was a gentleman in New Jersey, James Jones. He posted some comments for you, some questions, and I told him that I would ask. What are the long-term side effects?
I mean, it's going to take time to determine that because this vaccine actually came out 2020. So, we still need time to figure that information out. But based on the mechanism of action, it comes in, it gives the message, then it degrades and it disappears. And, if I made an educated guess, I don't foresee any long-term side effects with this based on the science. But we will see. Only time will tell.
And yeah, and that actually makes sense. So with a lot of the other vaccines, as you mentioned, they normally take 10 to 15 years to develop, and that could be because of funding issues, but time is time. And so only time can tell, right?
Exactly.
So that's something that when making your decision to get the COVID-19 vaccine, that's something to consider. I think a lot of people, and rightfully so, are hesitant, including myself, because I'm not sure what the long-term side effects would be. This is a new virus. The fact that it's a new virus, I don't want to get COVID, period. And now I remember my question. So the vaccine, it doesn't prevent you from getting the virus, from getting COVID. The vaccine helps to reduce, minimize, or possibly eliminate any symptoms. Is that the difference? Is that what am I saying?
Eliminate disease with a 95% efficacy. So yes, doesn't mean like you can get tested and still get tested positive, but it's just a minimum amount of the virus that may prevent you from spreading it or prevent you from getting sick.
Okay, so you just said, so getting sick, because there's a lot of people that have contracted COVID. So in the United States, we have almost 400,000 cases of COVID. We're pushing the mark. And so many of those people did not have any symptoms at all. But just because they didn't have symptoms, it doesn't mean that they were not spreading the disease, spreading the virus. And it doesn't mean that other people did not get sick, because people are getting sick and dying. We know that, right?
For sure.
And so if I receive the vaccine, in addition to me not possibly being sick, you're saying that the vaccine reduces my chances of spreading the virus to other people.
Correct.
Okay.
Correct. And again, and only time will tell again with the details, how much of the virus, needs to be, what the count needs to be to avoid spread and all these details. So this is all currently being developed.
Okay. And James's other question, he wants to know if the COVID-19 vaccine, I feel like I didn't want to answer, even though I have my answers for some of these. He wants to know, is the vaccine for children under the age of 16?
No, it is not. But I do know that they're currently doing the studies. And what would probably happen is they would extrapolate the data from the adults and probably try to figure out like what the amount of the dosage would be for a child. But that's to be developed. But right now it's not indicated for children. The Pfizer is indicated for 16 and older, and the Mrna is for 18 and older as of now, just to clarify the indications.
Thank you for that. And how long is the vaccine effective?
That is still being developed, but we know for sure it'll last a few months at least. But we don't know if it's going to be something like the flu shot or you get it every year. That information is to be determined, which is very important for the vaccine administrators to report any of these side effects, any of these incidences to the VAERS, which is the Vaccine Administration. What does it stand for again? The Vaccine Administration Recording, VAERS. I forgot the acronyms. I struggle with these.
Yeah,
but
don't worry about
VAERS.
that. Tell us what it is. What is that? So it's a reporting system. So it's like the database for everyone that's administering the vaccine.
Exactly. And the CDC also launched an app called Be Safe, which it's like a web-based system where it reminds you to get your vaccine. And it also, you can report like side effects that you've experienced as well. So it's definitely important, like when you get your vaccine, to make sure they give you your little card, and your card will tell you when you come back for your next shot. And also you can download that app, and that would be great data so that we can answer all these unknown questions. Right. And something else I want to make sure that I, get out there is the vaccine is for free for everyone, whether you're insured or not, and the administration will be reimbursed to that provider. So if you go out and people are trying to charge you, because there will be like scams and all kinds of programs, just make sure you know that you have free access to getting the vaccine and the administration.
Now, is that just in your state or that's federal?
It's federal.
Okay, I meant to say nationwide. Okay.
Nationwide, yeah.
And James's other question, does getting the vaccine decrease the possibility of one experiencing the long-term effects of the virus, such as stroke, heart issues, etc.?
Repeat the question one more time.
So the long-term effects of the virus that some people, based off of, we all respond differently to it, right? But some people have had heart issues and some long, kidneys and different things like that. Will the vaccine help to prevent some of those side effects?
I mean, I would say yes, because if you don't experience the disease state and you don't have any symptoms and no reaction, so then you would, less likely have a reaction that would cause you to lead to these, underlying conditions indirectly.
Okay, and so when you say the disease state, again, everyone, so the vaccine is helping to prevent you, so you can come in contact with the virus. And just because you come in contact with the virus doesn't mean that you will enter into the phase where you're actually getting sick, and which Dr. Cassandra is referring to as the disease state. And so once you're in that disease state, that's when the inflammation occurs. And then that's when it's affecting our heart and our kidneys and our other organs in our body. And so if the vaccine is preventing you from getting into that disease state, then therefore, just now, and this is just, I'm not a healthcare provider. I'm not a licensed medical anything, so I can't give health advice. I'm not on the research team or anything like that. But just logically speaking, if I'm not in the disease state, and if I didn't incur any of the heart issues, lung issues, then therefore I'm not going to have long-term effects from that because it never happened to me.
Exactly.
Does that make sense to you, Dr. Cassandra?
Yeah, perfectly said.
Okay. And just like with any disease and so now, and if we will address more questions, but just like with HIV or just any other disease, if some things can't be reversed. So if I smoke cigarettes and I develop emphysema, or I have scarring on my lungs, or certain things have happened to me, even if I stop smoking cigarettes, the damage is already done, right? And I can't reverse that. So we're trying to prevent the damage. And that's what preventative medicine is, preventative health, and that's what public health is. Public health focuses on the prevention of disease, and not just of your body, but for this particular point, we're talking about for this particular topic, we're talking about physical disease. But that's what public health is. It is prevention, and it's for prevention of groups. Healthcare focuses on the individual, and healthcare is actually more so responsive or reactive, should I say, and it's more so focusing on the care and preventing you from, they're trying to heal you, preventing you from trying to get sick either any further, or preventing you from dying, right? Because you've probably already entered a disease state. So that's what the COVID vaccine, that's what the intent is, to help to prevent that disease state and that spread. And the COVID-19 vaccines are one of many tools. The vaccines alone won't do it. So even if you do become vaccinated, even though the vaccine will decrease your risk of transmitting the virus to others, it's still important that you wear your mask and that you social distance. Only time will tell. This is new to us, this is new to the world, but we all have to do our part. So we all have to figure out what that part is. It's not going to hurt us to wear masks. It's not going to hurt us to not be in crowds. Apparently it's hurting a lot of people. Some people just can't stay. They have to go to parties and they have to be around and do different things. So anyway, I think personal responsibility and accountability, and for us to be able to take care of ourselves. And so Latoya asks me, am I getting the vaccine? Yes, I do plan on getting the vaccine, but like many of you, I am hesitant, and I actually plan to, I'm going to wait it out. I choose to stay home. I choose to wear my mask. My activities are actually the same for when we all first went on lockdown in March, and how we were really just going out just to go to the grocery store, to the post office. I'm still the same. I go outside and I walk and I make sure I get fresh air and I get sun, but I didn't spend my holidays with any friends or family. And so I'm still doing my part in protecting myself and my son. I do plan on getting the vaccine, but honestly speaking, not yet. I'm just going to wait. I'm going to wait a little bit. I do plan to resume my travel and travel around the world. So I expect that it will be required to enter certain countries. But again, I will wait, and I will go to cdc.gov and nih.gov, National Institutes for Health. So in the federal state, you all, we have the Department of Health, the Department of Health and Human Services. And under the Department of Health and Human Services, there are different agencies. And so one of the agencies is the Centers for Disease Control and Prevention, CDC. Another agency is, we have the National Institutes of Health. We have EPA, the Environmental Protection. Well, that might not, I don't think EPA is under Health and Human Services. But my point is there's a lot of different agencies in public health, but with nih.gov, that's the actual research and the science that you're following. CDC, is more so meant for public education, awareness for providers to go get information. But if you really want to take a deep dive into the science and you want to read more, we're talking, science language. We're talking mRNA. What is an mRNA? But if you really want to go deep into the science, NIH.gov. For those of you who are interested. But for me, that's what I'm doing. I'm going on NIH. I'm actually reading the research articles and science. I'm taking a deeper dive. So you have the individuals that are sharing information for us, and they're providing fact sheets because they are researchers, they're licensed, they're pharmacists, they're doctors, and they know what they're talking about, but they're getting that information from somewhere. So I want to know where you're getting that information from, and I want to read it myself. And so that I can make the decision for myself. But to answer your question again, LaToya, do I intend to get the vaccine? Yes, but just not right now. And what about you, Dr. Cassandra? Have you had the vaccine yet?
No, I haven't gotten the vaccine yet, but I plan on getting the vaccine because right now it's about access right now because my clinic hasn't received the vaccines yet. But I am trying to, take other measures to try to get it. And I'll share with you the reason why I decided to get it is when I think about the disparities in the community I happen to be a part of as a Black woman. And the reason is that let's say we're 3 times more deaths with COVID. When everybody gets vaccinated and, outside opens up again and everything goes back to normal, our disparities in our community is going to be even higher. So that's one of the ways that we can do our part to help our own community, even though it's scary, to take that step to do your part to help the community. I know there's a lot of questions, there's a lot of doubts, but that's pretty much what sold me, Shanta. I don't know, but that sold me. That pretty much solidified the fact that I'm going to get it.
Okay, and so I think a few people have a few clarifying questions on Facebook. So let me go ahead and take this off. And we have Peggy. Hey, Peggy, checking in from Chicago. Jimmy in Las Vegas, will this make a every year flu shot and COVID-19 shot never cured? So I'll respond to that because I'll just reiterate your messages that you said earlier. So Jimmy, the flu is a virus. COVID-19 is a virus. And so like when you're saying never cured, usually just scientifically speaking, their viruses are not necessarily curable. So you have bacteria and you have viruses. And so the medication that we take, like the antibiotics, that's for the infection that occurred or maybe like a parasite or something like that. But so for viruses, it's really just boosting your immune system and trying to stay healthy, because to my knowledge, there aren't any cure for viruses. Am I wrong, Dr. Cassandra?
That is correct. There's no cure for viruses. And, it's just some level of it based on how strong your immune system. So I guess it's important to make sure you eat healthy, eat healthy, work out, exercise, make sure that, you try to decrease the comorbids, because in our community, it's not that we're getting sick more often, is that when we get sick, it affects us more because we have the chronic illnesses such as hypertension, your diabetes, your COPD. So that is the problem. So again, like you said, viruses, it all depends on how it reacts to your body, and it will react to everyone differently.
Right. And then so those chronic diseases that you mentioned, what they all have in common are that they are kind of, I would say, like inflammatory diseases as well.
Correct.
And so in addition to behavior and lifestyle, it's important for us. So racism is a public health issue. And so it's also important for us to be able to find a way to manage our stress levels because stress, and I mentioned this before, and I can't remember in one of my shows, but I mentioned it before, how stress can impact our immune systems. If you are stressed and if your body comes in contact with a virus or bacteria, that virus or bacteria has a greater chance of doing what it is designed to do or what it wants to do in your body, because your immune system is compromised, not because you necessarily are in a disease state or you have a pre-existing condition. It could be your immune system can be compromised because of your stress level. And so we have to be mindful of, again, the information that we're taking in, the people that we're around, our practices, what's going on in our lives. Like, we have to be intentional about taking care of ourselves, because no one is going to take care of us. No one can stop that, right? We can, you know, so stress. So stress can also impact your immune system, in addition to what Dr. Cassandra was saying about some of the pre-existing conditions.
Yeah, I like the fact that you mentioned that. There was actually a study done based on the telomeres, which is like a part of our body. And the telomeres are actually shorter. They get shorter as you age. And this specific study was actually done in inner city, like 18-year-old boys. And these 18-year-old boys, because they went through so much racism, so much disparities, so much trauma, that their telomeres look similar to an elderly man. And that goes to show you, based on what you're saying about the stress causes you to be immunocompromised, and it affects your reaction to diseases and viruses and things like that. So that was a beautiful point that you made.
Yes. And then we have Shantu checking in from Maryland, and he says, do most medications and vaccines contain or start from a plant-based source? Oh, and if so, what are some of the natural sources that the COVID-19 vaccine is derived from? I'll leave that on the screen so you can respond.
It was created in the lab, and that's pretty much it. It's not natural. So it was created in the lab. So it's like a liposomal pocket where they put the messenger RNA, and yeah, that's pretty much it.
Okay. And some of us are naturalists, and some of us prefer to, I personally believe that the earth is, that's our source. And if we eat from the earth and eat with the earth in cycles. So think about, and so this is just health and wellness. This is not necessarily related to COVID-19, but just my belief, if we eat with the earth, then and not just eat with the earth, but also spend time in nature and going outside, getting the fresh air, looking at the trees, just that energy, that exchange, that carbon, that oxygen, so eating with the earth. Sometimes we like to eat certain fruits and vegetables all year round, and that's not natural. The earth is not producing that at that time. And so now we're consuming these genetically modified products. And so I think so seasonal, and this is just my philosophy. I haven't read this anywhere, but whatever the earth is producing at this moment, I would think that would be what our bodies are designed, we come from the earth. So whatever is being produced, whatever is growing right now, whatever's in season is what I mean. So whatever's in season, I would think that's what we should be eating, because that's what's being supplied to us from the earth, and the earth will give us everything that we need. But not all of us are that disciplined, or we don't have that level of understanding yet. So again, we're just having these ongoing conversations to kind of spark some different ideas and some way of thinking for all of us that are tuning in every Saturday. And again, I thank all of you for tuning in every Saturday and for listening to my guests. And I hope that you have some good takeaways from today's conversation. We have Lynn. Lynn is on, and she says she's in Las Vegas. And Lynn says, thanks for providing specific resource information. Is there any other questions, you all, that you have before we sign off? I think I don't have anything else on Facebook. I don't see any more questions. Oh, and yeah, so the whole, again, I want to address the infertility. How could that be? Is it documented? Is that documented, or is that a myth?
That is a myth, but there is a correlation with infertility with getting COVID. So I would say it's like a risk versus benefit because it's not determined. So if it comes up later, like it's kind of like a balancing act, right? Like you know for sure COVID potentially could cause infertility. So you should get the vaccine to prevent it. That's
So
where I
wait a
see
minute.
it.
So you said there's a correlation. So there are documented evidence where there are individuals that have had COVID and now they have infertility issues?
Yeah, there's some things that have come up, but of course it has to be further investigated. But
Okay.
again, everything is still, is being developed. But I have not heard anything documented about the vaccine having a causation. It's
Okay. And maybe
it's too soon. Too soon to determine.
right. And maybe that's where the misinformation comes from. And so maybe that's why, again,
Yeah.
before we share information with someone else or before we even believe it, maybe just ask someone, again, where's your source of information? Where did you read that at? Not where did you hear it from? Because it's a hearsay, and there's chain.
Right.
No, where did you read that at? And then again, those sources, you want to make sure that they are actually valid websites. And again, if you are not sure, contact your healthcare provider. Contact your local public health department. And if you don't want to, if you think that they don't have the right information, again, there's cdc.gov, not .com, cdc.gov. There's nih.gov and other different agencies. And I want to go ahead and close out. And thank you, Dr. Cassandra. Thank you, everyone, for watching. Again, I'm Shanta Jackson, and my purpose in life is to help people to help themselves and others. You can learn more about me. Visit my website at shantajackson.com, and you can follow Dr. Cassandra on Instagram, the PrEP and HIV Pharmacist. Again, the PrEP and HIV Pharmacist on Instagram, and of course, follow me on Facebook and Instagram at the Shanta Jackson.